Polycystic Kidney Disease, or PKD, affects millions worldwide, yet its early signs are so subtle that they're often overlooked. In fact, you might have even seen one of the signs earlier today without realizing it. Well, don't worry, because we're about to arm you with the top 10 warning signs of PKD, so you can recognize any potential problems with your kidneys. And later in this video, we'll be revealing how you can get your hands on a special free gift to help boost your kidney health, so keep watching. Starting things off at warning sign number 10, which is to do with changes in the color of your urine. Your kidneys filter 120 to 150 quarts of blood to produce about 1 to 2 quarts of urine. This urine is usually a soft yellow hue, thanks to a pigment called urochrome. But when the color of your urine starts shifting to darker shades, it can be a telltale sign of what's happening inside your body. Before you panic every time you're slightly dehydrated, it's important to know that many factors can affect urine color, from the food you eat to certain medications. However, with PKD, these color changes can be more persistent and often lean towards darker and murkier shades. This is because when cysts begin to form in the kidneys, they can affect the kidney's ability to filter your blood. In turn, your urine can become concentrated with waste products, leading to darker urine. So the next time you notice a consistent change in the color of your urine, you should go and get checked out. Next up, we're diving into a sign that's more than skin deep. At warning sign number 9, we're talking about skin issues. Our skin, the body's largest organ, often acts as a mirror, reflecting what's happening inside. And when it comes to PKD, this mirror can reveal some unexpected signs. When the kidneys aren't functioning at their best due to cyst growth, toxins can build up in the body. These toxins, which our kidneys would usually filter out, can show up on our skin in various ways. People with PKD might notice unexplained rashes, itchiness, or even a yellowish tint to their skin, a condition known as uremic frost. This isn't your typical dry skin, it's a sign that your body is retaining toxins it's trying desperately to get rid of. Another skin-related symptom is easy bruising. If you find that you're bruising more easily than usual, it could be due to the platelets in your bloodstream not working as they should, which is another side effect of PKD. Studies have found that many PKD patients report skin issues even before their diagnosis. While it's essential not to jump to conclusions with every itch or rash, if you're experiencing persistent skin issues alongside some of the other signs we'll discuss, it might be time to consult with a healthcare professional. While skin issues can be a subtle hint, our next warning sign is a bit more direct and a lot more uncomfortable, something that's mostly experienced by women. That's right, warning sign number 8 is frequent urinary tract infections, or UTIs. UTIs are infections that occur in any part of the urinary system, and while they're common, frequent UTIs might be a red flag for PKD. Here's why. As cysts grow in the kidneys, they can obstruct the normal flow of urine. Stagnant urine becomes a breeding ground for bacteria, leading to infections. Also, the cysts themselves can get infected, further increasing the risk of UTIs. And it's not just about the cysts. The structural changes in the urinary tract due to PKD can make it harder for the body to flush out bacteria, leading to recurrent infections. But here's the kicker. UTIs in PKD patients can sometimes be asymptomatic, meaning they show no symptoms. So while you might not feel that familiar burn, there could still be an underlying infection, silently causing damage. Regular checkups and urine tests can help catch these silent UTIs. And if you're noticing a pattern of recurrent infections, it's important to discuss this with your doctor, especially if you have a family history of PKD or other kidney issues. As we move forward, our next sign is one that's often brushed off as overeating or gas, but in the context of PKD, it takes on a whole new meaning. Warning sign number 7 is to do with the feeling of fullness. It might sound strange, but if you're feeling a sensation of fullness without eating a large meal, your body might be trying to tell you something. As PKD progresses, the cysts in the kidneys grow larger. These expanding cysts take up more space, leading to an enlarged kidney. An average kidney is about the size of your fist, but in advanced PKD, it can grow as large as a football. Imagine carrying that around in your abdomen. This enlargement can press against other organs, leading to that feeling of fullness. It's not your stomach telling you it's full, it's your kidneys, signaling that they're running out of space. Also, the enlarged kidneys can also cause a buildup of fluid in the abdomen, a condition known as ascites. This fluid accumulation can further contribute to the sensation of fullness and even lead to visible swelling. If you often find yourself feeling unusually full, especially if it's accompanied by pain or discomfort in the abdominal area, it's important to consider what might be happening beneath the surface. And speaking of swelling, our next sign is one that many might attribute to a long day on their feet or perhaps too much salt in their diet. At warning sign number 6, it's swelling or edema. Edema is the medical term for swelling caused by excess fluid trapped in the body's tissues. While it can occur in any part of the body, it's most commonly noticed in the legs, ankles, feet, and even the hands. But here's where PKD comes into play. As the disease progresses and kidney function decreases, the body struggles to eliminate excess fluids and waste. This fluid can then accumulate in the tissues, leading to swelling. But there's more to it. The kidneys also play a vital role in maintaining the balance of salt and water in the body. When they're compromised due to PKD, this balance can be thrown off, further contributing to fluid retention and edema. Typically, you might notice swelling in the ankles, feet, or hands. But with PKD, it's not just limited to these areas. The face, especially around the eyes, can also show signs of edema. It's a swelling that doesn't just go away with a good night's sleep or by elevating your feet. When this swelling becomes persistent, it's time to pause and take note. It could be your body's way of telling you that your kidneys need attention. Up next is a concerning issue by itself, but even worse when tied with PKD. But before we keep going, we'd like to thank you for watching with your exclusive free gift. This has been tailor-made to help anyone struggling with kidney problems. Just click the link in the description below and start your journey towards better kidney health. Okay, let's get back to the video with our top 5 warning signs of PKD. Warning sign number 5 is high blood pressure. When we think of high blood pressure, we often associate it with stress, lifestyle, or perhaps genetics. But there's another potential culprit that's not as commonly discussed: our kidneys. Specifically, a condition like PKD can be silently nudging those numbers upward, turning what might seem like an unrelated issue into a significant warning sign. The kidneys play a crucial role in regulating our blood pressure. They achieve this by maintaining a delicate balance of salts and fluids in our system. However, with PKD in the picture, this equilibrium gets disrupted. This is because the growing cysts can constrict the blood vessels within the kidneys, leading to a rise in blood pressure. Many studies have shown a strong link between the two. In fact, a staggering 60% of PKD patients were found to have elevated blood pressure. This isn't a coincidence. The narrowing of blood vessels due to cyst growth can make the body release certain hormones, increasing blood volume and, in turn, blood pressure. It's a domino effect, with one issue triggering another. Monitoring and managing blood pressure is essential, especially if you're at risk for PKD. If you find your readings consistently on the higher side, even if you feel perfectly fine, it's a sign you shouldn't ignore. Moving on to warning sign number 4, we're talking about back or side pain. Pain is the body's alarm system, telling you that something isn't right in the body. And while aches and pains can be a part of life, consistent discomfort in the back or sides shouldn't be brushed off as just an aching muscle. As we mentioned, when PKD progresses, the cysts within the kidneys grow. This enlargement can exert pressure on nearby structures, leading to pain in the back or side, right where the kidneys are located. But that's not all. Sometimes, these cysts can become infected or even burst. When this happens, the pain can intensify, becoming sharp and sudden, so make sure to get checked out if you start feeling these sensations. With that understanding, our next sign is one that's visually alarming and can't be ignored. Next up at warning sign number 3 is a condition called hematuria, or blood in your urine. There are few things as alarming as seeing blood where you least expect it. And while there can be various reasons behind hematuria, when it comes to PKD, it's a sign you simply can't afford to overlook. This blood can appear in one of two ways. It can be visible, turning your urine pink, red, or even cola-colored, or it can be microscopic, where the blood cells are only detected under a microscope during routine tests. Why does this happen? Well, as the cysts grow and multiply, they can cause tiny blood vessels in the kidneys to rupture. When this happens, blood seeps into the urine, leading to hematuria. While occasional instances of hematuria might not always be a cause for panic, consistent or recurrent episodes should be a red flag. Up next, warning sign number 2 is kidney stones. Just the name can make some wince in anticipated pain. These hard deposits made of minerals and salts can form inside your kidneys and are known for the intense discomfort they can cause. PKD can change the environment within the kidneys, making it ripe for stone formation. These cysts can disrupt the kidney's natural balance, leading to changes in urine pH and concentration. As a result, minerals can start to crystallize and accumulate, forming kidney stones. Also, these cysts can sometimes trap calcium deposits. Over time, these deposits can grow, forming larger stones, much like how a snowball grows as it rolls down a hill. The symptoms of kidney stones are hard to ignore. Sharp, cramping pain in the back and side, often moving to the lower abdomen or groin, frequent urination, and yes, even hematuria, or blood in the urine. While kidney stones are common and can occur for various reasons, frequent occurrences, especially in younger individuals, might be a hint towards an underlying condition like PKD. As we approach the top of our list, our next sign is one that's often overlooked, but is one of the earliest signals of PKD. Warning sign number 1 is protein in the urine, also known as proteinuria. While our kidneys typically filter out waste and leave essential proteins in the bloodstream, when there's protein in the urine, it's a clear sign that the kidney's filtering system isn't working properly. Those cysts, which have been the central players in many of our warning signs, can damage the tiny blood vessels, or glomeruli, in the kidneys. These glomeruli are responsible for filtering our blood, ensuring waste goes out and essential elements like protein stay in. When PKD cysts cause damage to these filters, protein can slip through, making its way into the urine. But how would you know if you have proteinuria? It's not as evident as blood in the urine. Early stages might not show any noticeable symptoms. However, as it progresses, you might notice a foamy or frothy appearance in your urine. This foaminess, often compared to the frothiness of scrambled eggs, is due to the excess protein. Proteinuria isn't just a standalone issue. It's often a precursor to more severe kidney problems and can even lead to chronic kidney disease if left unchecked. Regular urine tests can detect proteinuria, so if you're experiencing other symptoms we've discussed, or if there's a history of PKD in your family, regular checkups are important. With that, we've covered our top 10 warning signs of PKD. Knowledge is power, and being aware of these signs can make a world of difference in early detection and management. If you found this video helpful, please like and subscribe, and don't forget your free gift in the description below. Until next time, take care and be well.